So the cost of dental implants, lots of questions about how much they are. So what affects the cost?
Yeah, so I came up with a list that I thought about, and I have it right in front of me because I don't want to leave anything out.
Okay.
First thing is the implant cost. So there are many implants. There are regular implants, long, short, mini, pterygoids, zygomas. They could range from a few $100s to $1,000.
Okay.
You know, a lot of times I search on Google the cost of dental implants, and I find these ads for $9.99 or so. I don't find these prices to be accurate because it's only the dental implants part, but there's also the abutment and the crown part of it, and they're leaving that out.
So it sounds like a little misleading.
Exactly.
Okay.
Exactly. So the second thing that affects the cost is how many doctors are involved in the treatment.
Okay.
See how it's typically done in certain scenarios where the patient sees an oral surgeon or a periodontist specialist. They put their implants in, and then after 3-4 months, when they heal, they go back to either a prosthodontist or a general dentist where they put in the teeth.
Okay.
And then they go to a third even dentist where they maintain them for their annual visits. So in my office, I'm able to do both parts. So I'm able to shorten that from 1 year to as short as 3 visits.
Okay. Okay.
The third thing that can affect the cost is how many surgeries needed. You know, in certain scenarios, you might need a bone graft, you might need some sinus lifts, you might need some tooth to be extracted. So, you know, it depends on the patient. We can come up with a plan that suits them better. So the next thing that can add up to the cost is the big lab bill. And I used to do it this way. So send it to a lab, and I get this big lab bill, and I have to, patient has to pay for that. And now we can have in-house lab where I can print my teeth in the next room.
So you've invested in technology where you make the teeth?
Yes, it could literally be printed in the next room and cut down on the lab cost for the patient, and you know, with a better outcome. The next thing that can affect the cost, everyone needs to know about what dental insurance covers. A lot of these dental insurances can cover up to $1,000 or $2,000 per patient per year.
Okay.
And you know, it's a lot of times, you know, my patients end up financing this. We have third-party finance companies that they can go through and help them with the cost. You have to have an okay credit, but we can help them with these third-party finance.
What about Medicare and Medicaid?
Unfortunately, they don't. But you know, we always try to use their insurance as much as they can, whether if they're covering for extractions, whatever it is, we'll use that insurance. But again, a lot of times my patients have to finance the rest of the procedure.
And this is common across the country. You said like 80% of people are financing these.
Yes.
Okay.
The next thing that can affect the cost is the type of material the teeth are made out of.
Those final teeth?
Yes.
Okay.
There are a lot of different types, like PMAs, plastic, acrylic, zirconia. Now, we like to have our patients walk out with zirconias because these are the best translucent, more durable materials that they can chew with.
They're strong.
They're stronger than any other material that I've seen in the market. The next thing is, you have to know, are you getting a snap-in denture that comes in, comes out, or a new set of teeth that does not come out? There's a big difference in cost there.
Okay, okay.
And lastly, training and experience. You know, I've traveled all over the world. I take over 200 CE courses every year to go over the latest innovations and technologies and techniques.
So the goal is to get it done right the first time.
Exactly, exactly. You don't want to. This is the last thing you want to do is redo these implants or bridges because you know your time and money is important to you too.
So when a patient calls and says, "Doctor," or they call your front desk and says, "How much are dental implants?" I guess it's just not that easy to give a quick quote over the phone.
Yeah, the best thing I tell them is to come in. I invite them for a consult. We'll go over their plan, their best options, and the cost. And it's much better than doing it over the phone, so we can see.
So the only catch is they got to come in for a free consultation, and you'll give them a treatment plan in writing, right?
Of course.
And they could shop that.
Of course.
All over town.
Of course, and we're usually less than our people around us because of these reasons I mentioned.